here is my situation, I guess. I wanted to talk about myths about eating disorders and I guess what people think that your weight should be, because if you're anorexic or if you're bulimic, then you should be a certain weight. That is wrong. Just because someone doesn't look sick doesn't mean they don't have an eating disorder. It's what's going on in the inside of their body that matters, not so much on the outside. So there's a couple myths that a lot of people believe to not be myths, and I wanted to just give you a little bit of information to kind of help you understand and a little bit more about eating disorders and those that are affected by them. And feel free to, give this to a family member or, a teacher or whatever, to kind of just give this information to them so they know that eating disorders are very, very, very serious, and people take them very lightly, and the media and society just does not help portray eating disorders. So the first myth is eating disorders are not an illness. Wrong. Okay, it is a severe medical illness. Eating disorders are classified as a mental illness in the American Society, or American Psychiatric Society, and mental health disorders. They're also considered to often have a biological basis, like with other mental illnesses such as major depression, anxiety, or obsessive compulsive disorder. It's the same type of thing. So yes, eating disorders are a very serious illness. Next myth: eating or anorexia nervosa is the only serious eating disorder. Wrong. All eating disorders are very, very serious. It can all be very damaging physically and psychologically, and they all have their effects. Although, excess weight loss is a feature of anorexia, it also affects of other eating disorders also can be serious or life-threatening, and such as like I can never pronounce this word. Electrolyte imbalance associated with purging, because when you purge, it throws off your electrolytes and it can cause cardiac arrest. Okay, next one. Eating disorders are uncommon. They are very common. Whoever thought of that myth is just plain crazy. Anorexia, bulimia, and binge eating disorders are on the rise of the United States and worldwide. Among U.S. females in their teens and mid-20s, the percentage of clinical and subclinical anorexia may be as high as 15%. Anorexia ranks as the third most common chronic illness among adolescent U.S. females. Also, recent studies suggest that up to 79% of females have had bulimia at some time in their lives. And current findings suggest that binge eating disorder affects 0.7% to 4% of the general population. So just because someone doesn't look like they have an eating disorder doesn't mean they don't have one. I'm in this really, really not a good mood today. It's kind of like don't piss off Melissa mood, because I had a really bad morning. And I'm just feeling very not down, not depressed, just very, I guess I just really feel educational, and I really want to just educate you guys and some people that just are so wrong on these myths. Next myth: a person cannot die from bulimia. Do I need to even explain this? I shouldn't have to, but I will. While the rate of death for bulimia is much lower than, seen with anorexia, because usually an anorexic is, really, really thin. But a person with bulimia can be at a high risk for death and sudden death because of purging, and its impact on, the heart and electrolyte imbalances. Laxative use and overexercising can increase risk or can increase risk of death in individuals who are actively bulimic. So yes, a person can die from bulimia. Believe it, it's true. Eating disorders are a choice. They are not a choice. Does a cancer patient choose to have cancer? No. Does a multiple sclerosis person choose to have that illness? Absolutely not. Eating disorders are not a choice. People do not choose to have eating disorders. I never chose to have an eating disorder. It just happened. I didn't wake up one day and say, hey, you know what? I'm going to develop an eating disorder, or I want to be anorexic because that's cool. No, that's not how it goes. That's not how it works. They develop over time, and they require appropriate treatment to address the complex medical and psychiatric symptoms and underlying issues, because there's a lot more to eating disorders than people really know. There's a reason why a person has slowly developed an eating disorder. They didn't just wake up one day and say, hey, I'm going to be bulimic today and I'm going to go purge my food. That's not how it works, and it's sad that people really think that it's a choice, because it's not. Next myth. Dieting is normal adolescent behavior. Well, no, it's not. While fad dieting or body image concerns have been normal per se, features of adolescent life in Western cultures, dieting or frequent or extreme dieting can be a risk factor for developing an eating disorder, because a lot of people that I've actually known to start doing diets, such as it's like orthorexia. It's someone that really doesn't really know that they have an eating disorder. Subconsciously, they do not know, and they are not aware of their behaviors, and they don't even realize that they're having an eating disorder. So early prevention or early intervention can also prevent progression to a full-blown eating disorder. And I cannot express this enough to try to get help as soon as you think that yourself or a loved one has an eating disorder. It's very, very serious. Anorexia is dieting gone bad. That's a myth, a huge myth. Anorexia has nothing to do with dieting at all. It has nothing to do with diet. It is a life-threatening medical, psychiatric illness, and it has nothing to do with dieting. Okay, next one. A person with anorexia never eats at all. No, actually, most anorexics do eat. However, they eat small portions. They measure out all of their food. They just tend to eat very small portions, and they lower their calorie intake. They lower calorie foods, or they eat very strange food combinations. Some may eat candy bars one day, and then the next day they'll eat nothing else to kind of make up for what they ate the day before. It varies, I used to eat this huge bowl of mashed potatoes, and it was a lot. It was a lot, and the next day I wouldn't eat it all, because I would kind of make up for what I did eat, if that makes any sense. So, yes, anorexic people do eat. They just lower their portions to a very small amount. Men who suffer from eating disorders tend to be gay. No, sexual preference has nothing to do with eating disorders or even developing eating disorders. I don't even know where that myth came from, but I'm actually on some common myths of eating disorders site, and I'm just reading them and kind of giving you my input on them. But no. You can tell if a person has an eating disorder simply by appearance. this bothers me, and this is the main reason why I made this video today. You cannot tell. Anorexia may be easier to obviously detect if a person is anorexic because they wear like loose clothing, and it just shows that their body is just very frail. Bulimia is really, really hard to, I guess, see in an individual because often they're just normal weights or may even be overweight. And I know you're probably thinking, a bulimic can't be overweight. Yeah, they actually can. Some people may have obvious signs, and such as like sudden weight loss or gain. Others may not have any signs at all. So people with eating disorders can become very effective at hiding the signs and symptoms. Thus, eating disorders can be, undetected for months, years, and sometimes a lifetime. I'm just grateful, I guess, that I got help at an early age. I got help when I was 16. Obviously, I still suffer to this day. I'm still suffering today. And I have slip-ups, and I'm going through a really rough patch right now. And, I'm doing the best that I can. But, hang on one second. It does not matter what you look like. You do not have to be super, super frail to have an eating disorder. You don't have to be all bones and skin to be anorexic. And the next myth here says eating disorders are an attempt to seek attention. That is wrong. The causes of eating disorders are complex and typically include environmental and biological factors. And people experience eating disorders often go through great lengths of feeling shame and just very low and depressed. Has nothing really to do with wanting attention. I don't think I have time for another one. Yeah, I do. It says here, purging is only throwing up. No, actually, the definition of purging is to evacuate the contents of the stomach or bowels by any several means. And in bulimia, purging is used to, compensate for excessive food intake. Methods can be laxatives, overexercising, throwing up, taking diet pills. That is purging. Purging is not only throwing up. So, this is my myth video on eating disorders, and I wanted to do this video because I had a conversation with a friend today, and we just got to thinking about, what people look like, and that you don't have to be severely skinny to have an eating disorder. And then I woke up having a not so good day, and I'm not having a good day today, so I'm just kind of feeling really, really down, and I needed to kind of educate because someone kind of said that I wasn't being educational, I guess, and it kind of really upset me. I love you guys very, very much, and I hope this video helped. Peace, love, talk to you guys soon, bye.